Welcome to the first ever episode of The Impact here on CTV. And bringing you the first ever episode, I am Amelia Nakitimbo. Now, this is a show that brings you stories from our communities and people whose lives have been transformed by the work of non-profit organizations. We have teams on the ground who are moving across Uganda, and they are discovering and unearthing useful information that we believe will leave an impression on you who is watching. Now, why NGOs, you might ask? Uganda opened its doors and provided platforms for NGOs as we know them today around the 1980s. And one of the roles of NGOs is to fill the gaps and to do work in places and areas where government is not able to reach with its funding and action. Now, through the Impact Show, CTV is inviting you on a trip to visit communities that have experienced transformation, and we are also eager to speak to organizations and the people who are behind this change. Now, one such organization is TEREWODE. In full, that is the Association for the Rehabilitation and Reorientation of Women for Development. I'll say that again because it's quite a mouthful. It's the Association for Rehabilitation and Reorientation of Women for Development. Now, the people running this organization want you to know the word Fistula, to know what it means, to understand what it means, and to join a campaign to end Fistula in Uganda. Now, if you're a child, you might ask, why should I care? If you are of childbearing age, or you have someone in your life who you care about who is also of childbearing age, this story of Fistula concerns you. But before we go any further, let's meet a young lady called Urogynaecologist. She's from Lira district. And when we return, we have special guests on set who will be discussing further with us. Let's watch this and we'll be back shortly. The story of Urogynaecologist's life is eerily similar to that of many underage girls, mostly living in rural Uganda. She fell pregnant and her parents sent her away to live with the man responsible for the pregnancy. With no financial resources and no mentor in life, Urogyna dropped out of school. When the pregnancy came to term, fistula and separation were not what she anticipated of this supposed marriage. The process of giving birth left her incontinent, meaning that she passed urine and stool uncontrollably.
I produced my baby. He's too much sick. Fistula came.
Her partner at that time wanted nothing to do with her once he realized her condition.
I don't want to see you. I don't want to see you. You go back home. You go back you home. I don't want to see you my homework.
Urogyna is at this workshop to share her healing journey with regional leaders and health officials from around the Teso sub-region.
It's very clear as most of the health workers of the region lack the basic knowledge about fistula. Much as people hear about this while at the medical training, however, when it comes to the ground, there's less appreciation by health workers.
The health workers produced to go and help mothers have limited knowledge. It may not be the case for the medical officers, maybe gynecologists who are specialists, but talk about broadly health workers. It is true. The level of health awareness about this issue is low, even among health workers.
So most times you will not see them out walking in the open, but they will be hidden inside a hut, somewhere sent quite far from the household. But these women do exist within our communities. And the person we've had who has had fistula for a really long time was an 88-year-old woman who had had it for over 60 years.
And that's just one story of one person who has experienced fistula, but that's a condition. I asked you earlier, why should you care about this story? It's because it's a condition that degrades both the physical health, emotional health, and also the dignity of anyone who suffers from it and also their family. And women with fistula experience devastating incontinence of urine and sometimes feces, and are usually ostracized because of all that is involved with them. But now with me on set, I have Emasu Sseruyabge. She's the founder of and executive director of TEREWODE, which we talked about earlier. She's passionate about gender equality and social justice. She's widely read, widely traveled, and the work that TEREWODE is doing in restoring the dignity of women and the hope of otherwise hopeless and rejected women is quite phenomenal. Welcome to our set.
Thank you. Good morning, our dear viewers.
Indeed. And later on, we'll be joined by Dr. Alia Godfrey, who is a consultant urogynaecologist at Mulago Women's Hospital. He has also done extensive research in the same area and has published a number of articles both locally and internationally on matters of reproductive health. Now, Alice, to go directly to you, you've done a lot of research. I mean, like I just mentioned, the work that TEREWODE is doing is phenomenal. And I don't know, I hope our viewers, especially those who are meeting you for the first time, can understand how much that is. Before we go any further, for anyone who might be tuning in and they're hearing the word fistula for the very first time, how do you identify a fistula? What do you because we've talked about there is incontinence of blood and, I mean, of urine and stool, but how do you identify a fistula? At what point does someone know that, I have a condition?
So technically, I think we'll have a doctor to explain more the technicality there, but from research and our experiences, most times the women who end up with a fistula discover that they have fistula after they have been discharged from hospitalization, after they have like 3-4 days after they have given birth, and most time during that time they will have been discharged and they are back in the communities. For those who have the chance to have given birth in a health facility.
Right. And
those who give birth at home, it's pretty much the same thing. But there are also cases of ladies who have experienced the uncontrolled leakage of urine, feces, and sometimes both of these stuff immediately after they have been taken away from the theater, and when they are recovering, they begin to notice that unusual leakage. Or even if they had given birth at home, still, some of them have discovered this pretty much too soon.
Right.
Yeah.
And Uganda right now is one of the has the highest number of cases in sub-Saharan Africa and the third in the world, which is one of the reasons why we are talking about this, to say, hey, Ugandans, we have a situation here to deal with, let's wake up. From the research that you've been doing, what are the most prevalent cases? Because there are different types of fistula, and I hope Dr. Alia, when he joins us, will be delving into that. What you have found from your research?
So actually, as long as a country has high cases of maternal mortality and neonatal mortalities, okay, the maternal mortalities, neonatal mortalities cases are synonymous with fistula cases. At least 2 to 3 mothers suffer fistula out of the 16 ladies that die daily in Uganda due to complications of childbirth. So 2 to 3 of them end up with severe morbidities, and obstetric fistula is the worst and the most severe of all. So today in Uganda, at least we lose 16 mothers every day due to preventable complications of childbirth.
Every day. Every day.
Every day. And these are not just statistics. These are human beings. These are our mothers, okay? And they exist. If you went to different villages in one single day and collected this data more accurately, you will be amazed that this is true. Yeah, this is true. Of course, these are numbers, and they tell us that really Uganda is the highest in the sub-Saharan Africa with these cases.
Right. I understand when you're saying these are people, they're not just statistics.
No.
You have a personal story
Yes.
right there, and that's one of the reasons, or one of the things that inspired you to begin TEREWODE. If you can share with us part of that personal story that inspired you to start this journey.
Yes, but you had asked what are the types, and I was saying that the types, all these women present with a leakage uncontrollably, that incontinence. And I say that you'd have most of them being caused by obstetric fistula, but there are also others that are caused by, by obstructed labor, prolonged obstetric labor, but there are also other categories that are caused by maybe they call them iatrogenic, meaning our doctors who deliver the mothers during the delivery of a child cause these cases. These are also, we are beginning to record quite a number of them, okay, whereby the delivery was difficult, and in the process, the doctor, in trying to help the woman, to help the mother out, also accidentally causes the fistula.
Right.
For very many reasons, I think that this happens. So going back to my statement that these are lives, these are mothers, these are daughters of this country. These are not just
and workers as well, and sisters.
Exactly, they are sisters, okay, our sisters. And this was my motivation to begin doing this work 20 years ago, while still a student on vacation. Why did I start? It's because I had my former girlfriends. I had 6 former girlfriends. 2 of them suffered the fistula. In my village where I was born and raised, 2 of them suffered the obstetric fistula. 4 of them perished due to preventable childbirth complications. When we are talking about a mother dying immediately after giving birth, when we are talking about a mother dying during the labor, before actually delivering the baby, or dying, due to immediately after delivering that baby, or 2-4 days after giving birth, it's real, because for me, that's what the experience of my former girlfriends went through.
All right.
And society did not seem to know, even their families. When I talk of society here, it appears like it's something in the wilderness. But I'm talking about really siblings. I'm talking about the husband, the men who are responsible to have given these ladies wombs. I'm talking about fathers, who are there with their daughters. That's what I'm talking about here. And they don't know what happened to these ladies. These ladies, may the 4 who perished, in their souls rest in eternal peace. Okay. But for me, I'm working to make sure that no woman, no girl child should ever die in childbirth, which could have been prevented.
Right.
They are preventable. When we say preventable childbirth complications, it means our country has the expertise. It has the health worker who have the expert, skills to prevent those. But also it means that as community levels, even these ladies who carry these babies have some responsibility. There are things they can do if they were aware and they had the ability to have prevented themselves from dying during those childbirth.
You talk about health workers, and in the clip that we saw earlier, there's a workshop that you held late last year to sensitize especially the top health officials in the Teso area. And one of the things that you mentioned was that the training that we have at the moment is not empowering health workers enough to deal with these situations. And there was a lady that we also met from that area who said she noticed that she was incontinent a few days later, like you mentioned, and she went to the health facility and they didn't know what to do with her. And they just gave her little medicine and sent her away. So in your fight to see where are you starting that fight from to ensure that something is done to empower the people who go through the training system, the health workers who go through the training system that we have in the country?
So the truth about obstetric fistula is that it's a neglected condition, health condition, and neglected by governments right from the time of planning, budgeting, programming, even in terms of research. So it's neglected. Even at the level of training of health workers, it's neglected. It's not like being a focus as a subject that is important of, the training. And so even specializations of health workers from those institutions, therefore, ignored obstetric fistula. So it's just being taught as a topic, you pass through and that is it.
A theoretical topic.
Theoretical
doesn't
topic,
seem to
yes,
be,
doesn't seem to be. And yet it is important because I think you read our statistics. Yes, there has been a significant effort by all through the leadership of the Ugandan Ministry of Health and other partners, including UNFPA. There has been, in the recent past, there has been some significant progress made towards reducing the statistics about obstetric fistula, which previously was at 200,000 case backlog, meaning out there in the community.
Like that
and
lady that we heard about had been there for
exactly,
60 years.
For 60 years. They are in the community trying to look for care. They originally try to seek for care. And when they don't get it, okay, they give up.
Where do they seek care from?
At our health facilities. Actually, most of these patients get to our health facilities, health center 3s, even some go to district hospitals. But when they fail, they go to traditional birth attendants. They look for those traditional medicine men. They try, they really try. And eventually, previously, they give up. They really totally give up. And they surrender themselves to, to the status quo.
Right.
Yeah. But this is all because there has not been prioritization of obstetric fistula at all levels. In training institutions, health facilities, there is no prioritization. People are not knowledgeable, they are not aware, and even those who have a level of awareness, they are handicapped. I mean, the care for fistula is slightly specialized. It needs to be specialized, because if the health facility doesn't have the right equipment, doesn't have the enabling environment for operating a fistula, then even if the doctors are highly skilled, okay, that fistula repair is bound to fail.
What does it take? What does it take to carry out constructive surgery?
I think it takes more than just having the skilled doctors who do the operation.
Yes.
But also the equipment that they use should be special, because you're repairing something that is really deep hidden inside there. When we talk of the bladder having been damaged to cause the leakage, the content leakage, or the rectum having been damaged, so these are really hidden organs, internal organs in our bodies.
Right.
And so they require also some specialized equipment. But also generally the environment, the theater. When I talk of environment here, I'm not talking about environment you could take them to Sheraton and I'm talking about the theater environment. Yeah, the health facility, the environment within the hospital itself. So if you look at the capacity of our health facilities, and you compare it with some in developed countries, you can even shed tears. You find one theater. I give an example of Soroti Regional Referral Hospital, but nevertheless, still I'm grateful for the management of Soroti Regional Referral Hospital. because we started this program in Teso, and it was Soroti Regional Referral Hospital where they were going for repair. But I won't tell you that the state of the health, the theater where these ladies go for repair is bad. It's really bad. It's quite frustrating. And you appreciate the work of the health workers there who still have to try. And it's not just only Soroti Regional Referral Hospital. It's a problem across the country.
Right.
You find that a regional referral hospital only has one theater, and it is small, even in space. So when I talk of enabling environment, in one theater, there are mothers who are delivering, there are accident patients, you know, who come and you must attend to them. So most times you find that even when the doctors have scheduled these ladies for theater, they have to delay taking them to theater and prioritize saving other lives.
Okay, we'll hold it right there. When we come back, we'll take lessons from what Soroti Regional Referral Hospital is doing right, which we can replicate in other areas. We are talking about the prevalence of fistula in Uganda. That's one of the issues. I mean, Uganda has one of the highest cases, or has the highest cases rather, in sub-Saharan Africa, and I think is the third highest across the globe. And we're discussing, we're creating awareness, of course, because this is a topic that Alice Emasu is very passionate about, and she has been shedding a light how work and her passion is causing change in this country, and I would like to rally you to also join the same. We're going for the short break. When we return, we'll also be joined by Dr. Alia Godfrey, like we promised. Alia, this is The Impact, and I'm Amelia Nakitimbo. Don't blink.
CTV is now on StarTimes. You can now catch all your favorite programs, our daily comprehensive news bulletins, and so much more on StarTimes channel number 248. Stay tuned for a world of endless possibilities. CTV. Don't blink. As we embark on a journey to realize our full potential, we all need expanded minds and limitless possibilities. We need to be accurately informed. CTV is your growth partner. With reliable, in-depth news, we tell the story from all perspectives. We bring you the story in real time. Catch our comprehensive daily bulletins in Urogynaecologist at 7 p.m. and PM edition at 9 p.m. CTV. Don't blink. Now showing on CTV. Start your day fresh with TV unlike anything you've seen before. Wake up with Sunrise at Sea for your daily dose of freshly cut stories, trending online discussions, self-care and constructive conversations. No topic is off limits. Watch Sunrise at Sea every weekday at 7 a.m. Now showing on CTV. Don't blink.
Welcome back from that short break. You're watching The Impact here on CTV, and it's the first ever episode that we're having. This is a show about bringing you the experiences from our communities of work that is being done by non-profit organizations. And we ask, why non-profit organizations? Because since the 1980s, they've been doing work and reaching areas where government has not been able to reach, and complementing the work that is meant to be done by government. And we have a team that's on ground and is traversing across Uganda, and they are bringing us experiences that we believe will leave an impression on you, whether you're an individual that is watching or even the organization that is doing that work. And today we're highlighting an issue that has been mostly ignored, like you had in the very first segment, has been ignored, and yet the numbers that we are seeing have put Uganda on the map, we should say, but not for the right reason. We have a number of women and girls in our community who are suffering from fistula, a condition that takes away their dignity, and we're here to know what exactly that is and how we can prevent it. And we have a very special panel with us. Dr. Alia, thank you so much for joining us.
Thank you.
Yeah, we had told our viewers to expect you. But before we go any further, I have a personal question for you, not so personal. While you are in the theaters and you meet someone, they approach you, how do you break the news that they have fistula? What words do you use to tell that to them? And what's usually the initial reaction?
Thank you very much for that question. Normally, when these people come to us, we first see them in the outpatient clinic.
Right.
And that is actually where the right place for them to get the information that they have this problem and they will need help.
Right.
And we always try to tell them that this problem, it's not their fault, because that they need that reassurance that they are not at fault. There are circumstances that have caused that problem to occur. And then the next thing you have to do is to take them through the whole process that could have caused that. And the next thing is to tell them that your problem has a solution. And that is also reassuring for them. Then that solution is normally to try to restore the anatomy that brings back the normal functioning.
What you call reconstructive
surgery, yes.
Right. Okay. Yeah. The people that you have met running TEREWODE, how do you break that news to them? And what's usually their initial reaction?
So the thing is that if that news was delivered to them the way doctor is saying, then it sounds like urgent. So there must be then immediate solution to restore that broken anatomy.
Right.
But the problem is that sometimes that is said and then the care is not available. Okay? So the immediate reaction is usually of stigma, fear for stigma. Yeah? What will my husband say? That's normally the first one. What will my parents say for the younger ones? What will my husband say? What will my parents say? Not that, what will I do? It's normally
what will the others think of me?
What is the reaction of my immediate? And because of that, then many of them quickly say, I contemplated to commit suicide, to take away my life. You see that? So once this message is being delivered that this condition can be treated, okay, this should be followed up by treatment. So we have to have strategies to reduce long waiting for care. And this is now happening with the doctors who are knowledgeable like Godfrey.
Yeah.
They are able to take time and explain, and even probably say at the specialized women and neonatal hospital, okay, we will conduct a camp, please come back on this day. Then you would avoid those kind of reactions.
Right.
But if this was at a health facility, health center 3, district hospital, those lower level, and the person suspecting this condition is not aware about how to send this woman, that could be dangerous.
A bit difficult for them.
Indeed. There's a question that we had reserved for you, Doctor, before you came. We wanted to understand, because I think in simple terms, we can define a fistula as a tear, somewhere in the reproductive area. But depending on where it occurs, it has a different name and maybe a different level of complication. How many types of fistula exist, and which one is the most complicated?
Thank you very much. The most common type of fistula is actually leakage of urine. And fistula by definition is actually an abnormal communication between the bladder wall and the birth canal. Meaning now that communication lets urine pass through the birth canal instead of passing the normal route, that is the urethra.
Right.
So when that occurs, there's loss of control of urine. Normally, the correct thing is for you to feel that you have bladder which is full, and then you must go somewhere to what?
To empty the
bladder.
Yeah.
But in this type of situation, you don't have that control. Even
Before
when
you know it?
Yes, even when you're in a place where you really want to say, let me wait for a few minutes and finish something, or let me not do this because the environment is not appropriate, it cannot happen. It just continues leaking continuously. You may have to continue moving with pads, and even sometimes that is not enough. So then you will have a lot of smell around you, and that makes you also fear living with people. And sometimes even people start shunning you because you are smelling.
All the time.
Yes.
Smelling of
So that is one type of fistula.
Yeah.
Then the other type of fistula is of fecal matter. That one is abnormal communication between the rectum and the birth canal. So in that one, it is actual fecal matter that passes through the birth canal, and therefore you also now start smelling the fecal matter.
Yeah.
Yeah. So these are two different types of fistula, and they all occur as a result of birth injury. But they can also occur because of other things. Trauma is one of them. The other one can also be cancers, and then there can also be infections. But by far the most common is birth injury.
Right.
Yeah.
And which one is you said the one that involves passing of urine is the most common?
Yes.
Which is the most complicated of the two?
Yes, please.
It's also the most complicated.
It's also the most common, yes.
And then the causes, because you've talked about complications with birth. I understand that there are issues or factors that lead to that, and they're different. They're different, especially depending on maybe someone's age, their size, their experience. If you can tell us about that.
When you come to why fistulas occur, there are actually three things that we talk of, the three delays we talk of.
Right.
All these are things that will actually affect a woman's access to the right type of health care. One is making a decision to go to the health facility. Like when your labor starts, you fail to make that decision.
How delayed is that delay for it to qualify as a delay?
To qualify it as, every minute that is wasted, every second that is wasted in accessing a health facility matters a lot in the formation of fistula, in the causation of fistula.
Because I'm imagining someone might feel what feels like labor pain, but they're not sure if it's labor pain. So, they stay behind.
Yes. What happens is the moment labor has started, sometimes some people do not think that it's necessary to go to the health facility for that service.
Right.
Sometimes they think they can do it at home. Sometimes they think they can do it with a traditional birth attendant. And in the process, your valuable time for appropriate intervention is wasted. Because there are some people where the pelvis is not appropriate or the baby is too big to pass through the birth canal. Eventually, we shall talk of the pathophysiology, the causation. So when that takes long, that period when the baby's head is compressing between the bone and the tissues of the birth canal takes long, then you find the death of tissues in that area becomes irreversible.
So it's the friction that
yes,
causes
the pressure, the pressure that cuts off. Let me just bring it in a more simple way. What normally happens is when the baby labor starts, the baby's head starts descending from the abdominal cavity, rather from the uterus, which is still in the abdomen, into the birth canal, so that it is eventually delivered out. So what happens is between the birth canal and the baby's head, there are tissues. So those tissues include the bladder tissue. So when the baby's head is passing through, and there's also bone in between. So when the baby's head is passing, those tissues can get compressed. But if it's a temporary compression, there's no problem. The baby passes temporarily, there will always be compression. But if that compression stays for long and it is in the same place what we call obstructed labor, labor which cannot progress, and the baby's head cannot get delivered, and therefore those tissues in that area die because the blood supply, because of the compression, gets cut off.
Right.
And every body part relies on continuous circulation of blood.
Right. I understand that for the people, I imagine, we talked about the difficulty of the person. Once you break the news to them, they're thinking, what will my family think? What will my partner think? What will my parents think? But I also understand that for the person who is taking care of this person, there's difficulty. There's something called compassion fatigue. What best practices would you advise on the caregivers and even the health workers who are nursing a person who is suffering from fistula?
I think they also need to know the information about fistula. First of all, fistula is not contagious. That when you touch on me, you'll also get it, based on the interpretation of the doctor. And then secondly, we need to also educate them that fistula can be repaired, and the success rate is high. Currently, they say it is 95%. In TEREWODE, we are seeing more than 95%, TEREWODE Women's Hospital.
Right.
So meaning that these caregivers need to know that this is a temporal measure. And also to know that where they need to be given information where this lady can go for care and how they should access that care. This is very important. Normally why people give up, the caregivers give up, is because they feel the situation is out of hand. There is no hope for what? For cure. And most times, society has also associated this fistula with witchcraft.
Because maybe it's unexplained.
Exactly. Yeah. So how do you relate with somebody who has been bewitched? They could also bewitch you in the process. You see that?
Yeah.
But also the other thing that goes on in their mind, there is also a myth, especially with our religious communities, that I don't intend to offend anybody here, but there are scriptures in the Bible that have been interpreted very wrongly, that God cast the woman right from the time of Adam and Eve. Okay?
And that's why they deserve to suffer from what they're suffering.
So if the caregivers realize, by the way, those kind of thoughts, those kind of perceptions have also made the men in the life of these women feel disempowered and helpless and make some of these radical decisions.
Deciding
because
to leave, yeah.
How do you live with a woman who is cast by God, for God's sake? And even you, a woman, if you feel that you are cast by God, what level of repentance must you do to come out of this problem? You even don't have the energy to go to seek for health care.
Indeed. And yet, for the people that you work on, what's like the shortest healing time that you've realized?
From experience, 14 days, a woman is able to get out of the bed and walk back home. But that necessarily doesn't mean that they've now recovered. But what you are seeing, what I can say, the indicator of success is that the patient is dry. They are no longer incontinent of the stool or of the urine.
Okay.
But now the other processes of continuous healing can go on, which requires some light kind of work and all that support. But the lady would be back at home. But you asked about the delays, and doctor did not talk about the delay.
Yeah, I didn't finish talking about the delays.
At the health facility.
Yeah. The second delay, we had just talked about the delay in making a decision,
yes.
The decision-making process. Then the second one is accessing the facility. That involves the transport, the terrain where somebody is, like very hilly areas where there are no good roads and what have you. You find fistula is common in such places where transport, access, or health facilities are very far. Like we have to cross large bodies of water. Those are sometimes beyond our what? And it requires.
I think that would explain why we saw more cases during lockdown, because there is no transport.
Exactly.
Yeah.
And sometimes people say, I really have to go to the hospital, but there's a lockdown. And sometimes you don't even have borders were not working.
Right.
And sometimes taxis were not working. And so that really became a big problem. Then the other delay, which unfortunately should not be occurring, is what happens in the health facility. This woman has made a decision. She has got transport, has reached the health facility. Now what requires to be done within the health facility? So there may be a delay in making a decision to intervene, to relieve that pressure. Meaning, women who have obstructed labor need to be delivered urgently, and that is through a cesarean section. If that is not done quickly, it means that obstruction is continuing and the fistula will definitely occur.
And I'm thinking that,
so that
obstruction,
third delay is health facility.
Inside the health facility.
Yes, yeah.
And that obstruction will have been understood when the person came for antenatal, I'm imagining?
Exactly,
right.
Exactly. So, now when it comes to prevention, those are some of the things we shall talk about when you want to prevent fistula.
Right.
Yes.
And then we talked about issues, if I'm to drive a conversation to what made sorority a favorable ground, what factors enabled the setting up of the TEREWODE facility in Sorority very quickly, and how we can replicate it to other regions, possibly?
So every strategy that TEREWODE has employed in the fight against obstetric fistula has been informed by the stories of these women we've suffered for treatment, the survivors of obstetric fistula, the former fistula patients. They have told us stories, and through those stories we've innovated ways. And there was no way you could ignore putting up a specialized hospital for these women in Uganda if you cared about dealing with obstetric fistula care. Well, I know in the beginning it was thought it's an expensive thing. Infrastructural prioritization in eliminating obstetric fistula in our countries is a strategy that really works excellently well from the experience we are having. Right. But it's highly costly and not affordable. But we are saying what's not affordable for our mothers. We say the women are the backbones of what?
Of the economy.
Of the economy. In any case, we are the majority. Eh?
Right.
Even God prioritized us when he thought of continuity of the world.
I see Dr. Alia shaking his head. I don't know if that...
Even here, you are the majority.
Indeed.
Yes. So yes, to avoid those delays, put up something. And TEREWODE Women's Community Hospital there is like a model for us to learn from. When we say it is costly, how much actually does it cost? And we hope to be able to answer that question soon. But also, through TEREWODE Women's Community Hospital, we are able to share best practices already with the Ministry of Health, all these partner health facilities, and other partners that are engaged in fistula. And already we are beginning to see that the policy for camp-based care of obstetric fistula, okay, is the government position. But we are saying, how can women continue to wait? Like during this time of the lockdown currently, health facilities are just full of these cases of patients of fistula.
Right.
And I congratulate all the partners who are supporting in this campaign, UNFPA, AMREF, and many others. There are many cases of obstetric fistula in the country. The lockdown has actually made the situation worse than ever before.
And there's something powerful that you mentioned when you had that workshop that we referred to earlier, and you mentioned that we're not going to wait for government. Mm-hmm. At local government, there's something that we can do, mm-hmm. and that's what you're telling us that you did. In a research that you conducted, Dr. Alia, you called for prioritization of training. I think now that takes us very quickly to the prevention. Prioritization of training, strengthening the surgical capacity, which will take us towards achieving universal health coverage. There's something we had talked about earlier. I had asked, what does it take to conduct surgery, reconstructive surgery and healing of fistula patients?
Unfortunately, fistula surgery is not cheap. Mm-mm. It's not cheap. But the surgery that is used to prevent it is much cheaper. The surgery, the cesarean section is much cheaper than fistula surgery because the supplies that is required and the manpower that is required is less when you're doing an intervention surgery for preventing what? Fistula. Right. But by the time you reach a fistula, the stage of a fistula, obstetric fistula, you use more supplies, you need more personnel, you need more time, and so the best thing really is prevention. Prevention. If the efforts are pushed more towards prevention, then that will go a long way in solving. And one of the tenets of prevention is awareness, and
which is what we're doing right now.
Which is being done here right now.
Yeah.
However, it does not also mean that when you do everything else, fistula will not occur. But fistula will still continue occurring because some of the circumstances are beyond anybody's control.
Right.
Now, when it occurs, you also need capacity for managing the cases that occur. And that is one of the things TEREWODE has done, establishing what they call, the right word for it is establishing one of the best centers in Africa for managing these fistulas. And that is going to be one of the centers of excellence. And I'm happy to say at this point that they have gone a long way in really achieving that goal. Right now, there are so many things that are happening in that hospital that actually match what is in other centers of excellence in Africa.
All right.
Yes.
That's interesting to know. We, unfortunately,
and one of the things they're going to do is training, building capacity for the management of those cases that have already occurred. And the good thing is they are collaborating with the Mulago Specialized Women's Hospital and Makerere University in building capacity in terms of personnel and human resource. The training will involve midwives and nurses, and then also
from across the country.
Yes, across the country. Yeah. Medical students, doctors who have already qualified. But the fistula is not something that is done by just anybody. It needs somebody to have specific training for the management of fistula. We earlier on, actually, I don't know whether we talked about it, that when fistula, we recognize, somebody recognizes the fistula, let it not be the first time it is touched, should be the time when it is best done. It should not be messed up in the first time. The moment you mess it up, you will end up making it more complicated, and actually you can even push this woman towards a situation we call incurable fistula, because the tissues have already been now disorganized more. Reconstruction will become a bit more complicated. Okay,
as we sign out of this show, if someone is watching us right now and they know anyone who has a fistula and maybe they are not in Soroti or anywhere near Soroti, what would you advise them to say? And that is in our parting shots, or to do?
I think we are so blessed now as a country. We have a dedicated hospital that provides routine care in Soroti. Soroti is within Uganda.
Right.
It's not like in the USA where we have to charter the planes to fly to the USA for care.
And so receiving people from outside Uganda coming to Soroti as well?
Not yet. The hospital is currently serving only us in Uganda. From Western Uganda, Northern, these ladies are coming.
Yeah. And then a few of those people who are not Ugandan nationals, but have been here for very long.
They are here, yes. We have a
Ugandan residents.
Yes, residents.
But also the other thing is that in TEREWODE, our strategy is that actually we aim at giving women information and making services available so that they can make choices. It's very important from a rights perspective. And you can't make a choice if you don't know the available opportunities. So we are also saying we collaborate with the Mulago Specialized Hospital and others, Mubende. We come in and collaborate with other partners like UNFPA. And during mobilization of these ladies, if you have them, we will ask you where you want to receive your care from. And we'll try to work with you to make sure that you receive your care from that community where you want to have your repair from.
Right.
Making services available to our ladies.
Doctor, you're parting short.
So the other thing which we didn't talk about is, yes, at TEREWODE, these services are being provided. We also do provide these services in the Specialized Women and Neonatal Hospital. And that is why we are having a collaboration with the TEREWODE.
That's at Mulago.
Yes, at Mulago Specialized
Mulago Women's Hospital.
Yes, we also conduct routine repairs other than camp-based repairs. So we do clinics on every Friday to what they call to see those who need the service, what we call triaging. They come, then we decide who needs the service. So that service is available in the Specialized Women Neonatal Hospital. But the other thing I wanted to say is these services are now available, however complicated they are, both at Women's Hospital and the TEREWODE Hospital in Soroti. These services are very much available. And the good thing is we also receive experts from outside, and we do workshops every quarter at TEREWODE Women's Hospital in Soroti, where those really very complicated cases are being managed, very, very complicated cases, in conjunction with what? Experts from outside Ethiopia, Germany.
Right, there you've heard it. Unfortunately, we ran out of time, but we could have gone on and on. We're bringing awareness about fistula, but this is the first episode of The Impact here on CTV. And like we made a promise to you, we are bringing to you people and organizations who are changing or who are shining a light and creating impact in our communities through the work that they are doing. And justly, the work that is, or justifiably, the work that is being done by TEREWODE deserves to be recognized, not just TEREWODE, but also institutions like the Mulago Women's Hospital, where Dr. Alia Godfrey is coming from. Well, thank you so much for staying with us. Month of the Woman returns tomorrow, and more programming is lined up for you today. PM edition at 9 p.m. and Njube Golobia at 7 p.m. You can also follow the social media platforms on CTV at CTV Uganda. Thank you for staying with us, and goodbye.